I found my childhood medical records and discovered why my mother always told me I was too dramatic. The manila envelope sat on my kitchen table for 3 days before I found the courage to open it. Inside were my complete pediatric medical records, part in 15 years of doctor visits, immunizations, and hospital stays. I'd requested while trying to piece together my medical history after years of gaslighting. My mother had always dismissed my health concerns. "You are being dramatic," she'd say when I complained of debilitating stomach pain. "It's just for attention," she'd tell doctors when I couldn't keep food down. By high school, I'd internalized her narrative. Her and maybe I was imagining things, exaggerating normal discomfort, seeking attention. I started with my earliest record, working forward chronologically. Everything seemed routine until I reached age 7. That's when I found the first emergency room visit for severe abdominal pain and vomiting. The doctor had ordered an ultrasound and blood work, noting possible appendicitis. My heart raced as I read the doctor's notes. Mother declined further testing, stating child has history of dramatic behavior. Against medical advice, patient discharged 2 months later, another ER visit, Rika Hospital, same symptoms. This time the doctor wrote, parent insists symptoms are psychosomatic. Re-resting psychiatric consult rather than GID workup. Over the next 5 years, I counted 17 emergency room visits across 6 different hospitals. Each time, my symptoms were dismissed as behavioral issues based on my mother's insistence that I was seeking attention or manipulating for sympathy. Then I found it during the visit that changed everything. At 12 years old, I'd been taken to the ER while my mother was out of town and my aunt was watching me. The attending physician, Dr. Levin, ordered a comprehensive workup without my mother's interference. His findings were devastating: 3 NOS, presence with severe malnutrition, electrolyte imbalance, and intestinal inflammation consistent with untreated Crohn's disease. Condition appears long-standing and severe. Child reports years of symptoms. Dismissed by parent as dramatic behavior. Recommend immediate admission and Child Protective Services consult. I had Crohn's disease, part a serious autoimmune condition that causes inflammation throughout the digestive tract. I'd been suffering from a treatable condition for years while my mother convinced medical professionals I was making it up. The records showed that my mother checked me out of that hospital against medical advice and transferred me to another facility where she controlled the narrative once again. She told the new doctors I had a history of factitious disorder, essentially claiming I was faking symptoms for attention by some miracle. This doctor ordered his own tests rather than relying solely on my mother's account. His notes were damning. Mother's description of child's behavior inconsistent with presentation and test results. I finally received proper treatment at age 12, but the damage was extensive. The records documented intestinal scarring, malnutrition, related growth delays, and vitamin deficiencies that would affect me for years. The most chilling discovery came in a social worker's notes. Mother displays concerning behavior consistent with Munchausen by proxy, but in reverse Terran denying child's legitimate medical issues rather than fabricating them. Recommend psychological evaluation of parent and supervised medical care for minor. That recommendation was never followed. My mother maintained control of my medical care, though she couldn't prevent the Crohn's diagnosis and treatment. She simply incorporated it into her narrative. Parent I had the condition but was dramatic about the symptoms. Yesterday I called my mother for the first time in 2 years. When she answered, I simply asked, "Why did you tell all those doctors I was making up my symptoms when you knew I was really sick?" There was a long silence before she replied, "You were always such a difficult child that always needing something. The attention should have been on me. Parrot, I was the one taking care of a sick kid." I hung up and blocked her number. Then I called my therapist to schedule an emergency session. Sometimes the most painful diagnosis isn't the one in your medical records. Pertard, it's recognizing that the person who should have protected you was the one causing the harm all along.